Well, if you've had a stroke, you may be at risk for another one. The good news is that the most second strokes are preventable with a healthy lifestyle. And Dr. Carolyn Brockington is the director of the Stroke Center at Mount Sinai St. Luke's and Mount Sinai West Hospitals in New York City. All right, let's talk about this. How is the American Heart Association, American Stroke Association using music to increase stroke awareness?
Well, we want everybody to know what to do if they or someone they love is having a stroke. So how to remember the common warning signs of a stroke. The American Heart and the American Stroke Association is using a parody of the song we all probably know, YMCA, to remember the acronym FAST. So if you think of the word FAST, F-A-S-T. F would be for face. You look at someone's face, is it drooping on one side? They might be having a stroke. A is for arm. Do they have arm weakness where they can't keep their arm up? S is for speech. Sometimes they have garbled speech or they can't communicate well. And then T is for time. We want people to know that you have to call 911 right away, because the faster you get to the emergency room, the more likely your outcome will be very good after stroke.
Absolutely. Let's talk a little bit more about that, because I think it's important to talk about how to recognize a stroke, some of the signs, and then talk us through a little bit of the warning signs.
Well, the warning signs are important because you probably know that the minute the brain doesn't get enough blood flow, people have symptoms after that. So it's not symptoms that occur over months and years. This is over seconds to minutes. And so the symptoms develop right away. And we want people to know that time is brain. The faster someone comes in, the more likely we're able to treat them fast and reduce the amount of brain that's injured from stroke and therefore the disability. So remembering the acronym FAST helps them remember some of the symptoms that we commonly see, that someone's face might be drooping, their arm is weak, they can't speak very well, and that to call 911 right away. So it's important to recognize the symptoms right away, call 911, and go to the closest emergency room for rapid treatment.
Absolutely great information. Let's talk about before that, before we get to the point where the stroke may be happening. Some little tips to reduce the risk of a possible stroke.
Well, many people don't know that 80%, up to 80% of strokes can be prevented. And it really is just by identifying your own personal risk factors, right? So for instance, we know high blood pressure is the #1 reason why people have strokes. So if you have high blood pressure or hypertension, your doctor might call it, the most important thing is to control it, not just for one day, 1 week, but your whole lifetime. So that might be through diet, through exercise, lifestyle changes, even medicines. Many times we also use aspirin to reduce the risk of stroke. So knowing your own personal risk factors, having a discussion with your doctor about what to do about them and how to control them, not just one day, but many days. So we know high blood pressure, diabetes, smoking, heart disease, even family history is associated with increased incidence of stroke. So identifying your own risk factors and again, having a discussion with your doctor about how do you control these to reduce your risk of stroke.
All great information. Really appreciate you bringing this to us. And for those out there watching, where can they go to get all of this in one spot?
Yeah, for all the information you need to know about stroke, the common warning signs and what to do, go to strokeassociation.org.